Hello everyone and a very happy new year to all of you. This is the first video in a series of videos where I am going to talk about everything that you need to know about thesis in postgraduate dermatology. Right from the beginning up to the end of it, everything that you need to know, little things that I learned along the process. So here's an overview of the things that I'll be addressing in the series. Firstly, what is thesis? A brief overview. Secondly, the things to keep in mind while selecting your thesis topic. And thirdly, thesis procedure. So a step-by-step procedure guide from start to finish. Hey friends, welcome back to my channel. This is Dr. Anmol and I'm a doctor based in India. And on this channel, I talk about all the things that are relevant to being a doctor and a dermatologist in India that I learned along the way. This is part 1 of your ultimate thesis guide in dermatology residency. So don't forget to subscribe and stay tuned for more. Let's get started. So a thesis is something all MD students have to finish during their post-graduation. It's basically a study, a research project that you complete under the guidance of your guide. Your guide will be the principal investigator in this project and you will be the co-investigator. On an average, you have about 18 months to finish this study, at the end of which you compile all the data in the form of a book and submit it. That's your thesis. Now, I think this is the most important part of the entire process. There are a lot of factors to consider while choosing your thesis topic. You will be faced with one of the two scenarios. Either your guide will have a topic in mind and they will just give you your thesis topic and that's it, your job will be done. You don't have to wonder about which thesis topic to select. Other times, as in my case, they will ask you to pick up a topic. They will ask for your input. Now, if that happens, you are obviously going to be absolutely lost, right? I mean, you don't even know all the topics in dermatology at that point. It's a very important decision that I don't think a first-year resident who has just joined residency a couple of months back can actually make. So now let me try to help you understand the things that you need to consider while picking your thesis topic. So the important thing to understand is that your thesis is your first independent research project in your career, the first of many more to come. You are obviously bound to make mistakes in your first project. So just treat this as your learning project. Keep it simple, try to keep it easy and doable. That's rule number 1 according to me. Don't take up a very difficult or a very complicated study, a topic that you don't think you yourself very well understand at this point. When you're choosing your thesis topic, you should be able to be very clear in your mind about what exactly is the purpose of that study and what exactly are you going to do in that study. Because your thesis is something you're going to have to do by yourself with very little help from other people. So keep it relevant, but at the same time, try to keep it simple and doable. That's step 1. So the first thing that you need to decide is what type of study will it be. Now, it can either be a prospective study or a retrospective study. A prospective study is one where once you have started the study, after that you start collecting the data. And a retrospective study is that the data is already present in your department in the form of records or, whatever, biopsy book records, and you just have to study the data. That would be a retrospective study. It can be a cross-sectional study where you collect all the data at a single point in time, or it can be a longitudinal study, or a case control study, or a clinical trial. So in a cross-sectional study, you're collecting all the data at one point in time. The patient comes to you, you collect the data. Even if the patient is lost to follow-up, it's not a problem. While in a longitudinal study, you will have to keep the patient on a regular follow-up basis to collect the data. So now let's discuss the pros and cons of each study type. The advantage of a prospective study is that you will collect the data. So there is lesser chances of missing data. In a retrospective study, this can be a disadvantage. There can be missing data which was not collected properly. So you can have gaps of missing information in between for your study. But the advantage of a retrospective study is that it's easier to get ethics committee approval. So if you feel that it's an ethically controversial topic, you can go for a retrospective study. Otherwise, I think it's always better to go for a prospective study design and start fresh. Now talking about a cross-sectional study versus a longitudinal study or a case control study or a clinical trial. So now obviously if you go for a comparative study or a case control study or a clinical trial or any study where a comparative study is basically any study where you're comparing two results. Group 1 you gave this treatment, group 2 you gave this treatment, and now you're going to study which group responded better. This is an example. So now obviously the advantage with such studies is that they are more relevant. they give you good new information. So they are always nice to do. They have more value and they are more relevant. That is the advantage. But the downside is that in some places it's difficult to get ethics committee approval for such studies. But if you think it will be easier for you to get an ethics committee approval, such a problem is not there at your institute, then you can always, I think it's better to go for a comparative study, you know, where you're comparing two treatment modalities or two diagnostic modalities. I think they are much more relevant than your regular, you know, a clinical epidemiologic study. Another option, if it's difficult to get an ethics approval, then the other option is to do such a study retrospectively. So if you have records in your department which compare the data of one particular laser versus the other laser in a particular modality, then based on that, based on those records, you can go for a retrospective study as well. The other disadvantage of a comparative study or a case control study is that the methodology is obviously much more complex. Same is the case for a clinical trial. So you need to properly find a way to follow up the cases and make sure that you can assess the results. You have reliable methods of assessing the results in both the study populations. So if you go for such a topic which is a little bit more complex, a comparative study, you make sure that you understand the steps in your study properly and you're very clear about the methodology. And it's also nicer if you can, if you think you'll be able to count on your guide for adequate guidance throughout the study. Now, if you want to keep your thesis very simple and easy, and you think that you will have to do it all by yourself, you don't have much support or guidance, then I think you can go for a cross-sectional study, considering that the methodology is much easier. You just have to meet the patient once, collect the data at one point in time. No follow-up is required for cross-sectional studies. For example, clinico-epidemiologic study, like my thesis was clinico-epidemiologic study on photodermatosis. So all you have to do is all the patients in your inclusion criteria. Once you see the patient, you have to take the history, examine them, collect the data at one point in time, and that's it. Even if the patient doesn't follow up, it's not an issue. Another example would be to study the dermoscopic features of a particular entity. For example, I did a study where I studied the dermoscopic features of lichenoid disorders. So in that also, that can be a cross-sectional study. You can just, whenever the patient comes, you can study the dermoscopy of the lesions and collect the data and keep it with yourself. So dermoscopic studies are another good option, because I think dermoscopy is also a very currently relevant tool, and we need more studies on dermoscopy. So you can go for any dermoscopic study, and that would be a cross-sectional study. If you want to add more value, you can also go for dermoscopy histopathology correlation. So you can correlate the dermoscopy with the histopathology of the lesions. So my final word would be that while choosing your thesis topic, consider all of these factors and then decide. If you'll have to do it all by yourself, if you think you don't have any support, I would suggest that you keep it simple, because this is your first research project. So don't worry about it. You'll do many more. And it's very important that you very clearly understand the exact methodology of the study and the purpose of the study. These two things should be very clear in your mind. The step-by-step methodology, what exactly are you doing? Okay, now you're going to collect, this is going to be a sample size, you're going to collect the patient is going to come to you, this data you have to collect, what are you going to compare, how are you going to draw an inference from it. All of this should be very clear in your mind. Your study methodology should be very clear in your mind. And second thing, the purpose of your study. What are you trying to gain from the study? What is the study going to add to the already existing literature? Try to have a good idea about this as well while choosing your topic. For example, my thesis topic was a clinico-epidemiologic study of photodermatosis in my region. So now I have to be very clear कि अभी clinico-epidemiological study में what am I going to study? What are photodermatoses? What all kind of patients are going to be included in my study? Once I'm clear about my sample population, that all the patients with photodermatosis are going to be my sample population. Now, what am I going to collect? I'm going to collect their clinical data and their epidemiological data. Then I'm going to study it. What am I going to study? How many males are there? How many females are there? What is the main age group involved in photodermatosis? What are the most common clinical features seen? What are the rare clinical features seen? What are the different patterns seen? So I'm very clear in my mind about what all things that I'm going to study. So this is how you should also have that clarity about your thesis topic. Now, once you've figured out the study design, the next step is choosing your study topic. Doing that can obviously be tricky. You have just started to read dermatology. Here are a few things that might help. Firstly, you can go for a topic that you already seem to have a little bit of interest in. For example, I remember a colleague of mine who was interested in acne. She did not know what she wanted to study, but she knew that she wanted to she wanted her thesis to be related to acne. So if you too have a particular area of interest, or you find a particular topic interesting, you can look up journals and see the studies that are being done in other parts of the world, in other parts of the country related to that topic, and that can give you an idea about what you can do as a study as well. Second option is you can look up various dermatology journals. Nowadays you have easy access to all the dermatology journals online. If not, you can also visit a library. So just scan through the journals, look up the journals, and see if you find a particular study that you can do in your institute as well, a similar study which is already being done in other parts of the country or other parts of the world. So you can refer to the various dermatology journals like IJDVL, iDoge, iJord, or IJD to get an idea about the different research that is going on around the country, and go for a similar topic or a similar study. For example, my thesis was studying the photodermatosis patterns in southern region of India, while I got the idea from a similar study that had already been done in the northern region of India. Off the top of my head, I can give you a few ideas as well. You can study the epidemiology and clinical aspects of any disease in dermatology or a group of diseases. For example, clinico-epidemiologic study of photodermatosis or clinico-epidemiologic study of palmoplantar keratoderma. Another thing you can do is you can pick a region, for example, face, axilla, flexures, and you can study the various types of lesions that occur only in that particular area. For example, clinico-epidemiologic study, clinico-epidemiologic dermoscopic and histopathological study of all the papulonodular lesions occurring on the face, or clinico-epidemiologic dermoscopy and histopathological study of pigmentation in the axilla. So multiple diseases will come under your study. Another example is a study of all the dermatoses that occur in the flexures. Thirdly, dermoscopic studies are my new favorite. Dermoscopy is an upcoming field in diagnostic dermatology. It's very much relevant and it's super easy to do. You just have to study dermoscopic patterns of the lesions of a disease or a particular type of lesions, and then you can correlate them clinically, you can correlate them with the site, with the morphology of the lesions, or histopathologically. So you can study the dermoscopy of a particular disease at different sites. For example, you're doing a dermoscopic study on lichen planus. So lichen planus on the hands, on the oral mucosa, on the scalp, on the flexures, extensors, trunk. You will find various dermoscopic patterns in different regions. Similarly, you can go for any other topic as well, but that is how you can do a dermoscopic study. Or you can study the dermoscopic features of some particular lesions. For example, dermoscopy of papular nodules on the face and neck, dermoscopy of pigmentation in the flexural areas. So these were a few ideas that I think might help. Now, whichever topic that you finally choose, once you've decided on a topic, make sure that you read that topic well from all the standard textbooks and understand it very well before starting your thesis. Understand the topic and also understand the objective of your study and what it will add to the existing literature. You need to know what is the current epidemiology of the study, what are the current clinical patterns in order to further add up to that. So do a brief literature review through textbooks and online articles and try to get a good idea about what's already known about this topic. Only then can you figure out clearly what parameters you will study, and that will also help you formulate your case record form in a better way. My final advice would be, once you've chosen a thesis topic, try to look up similar studies online, similar studies that have already been done in other parts of the world. Obviously, it's always easier if someone has already done a similar study before and published it. That way you can refer to the methodology that they had used, the parameters that they had studied. So it's like a template for your thesis, and it really helps. So that's it. That's all that you need to know about picking your thesis topic, which is the step one of this very extravagant process. I hope you found this helpful. I wish you all the very best. I will try and make more videos about the next thing that you need to know, that is the process of how to go about your thesis. Please feel free to get in touch with me if you need any help. Get in touch with me via Instagram or on email and we'll figure it out together. Thanks for being here. I'll see you in the next one.